Korin, thanks for joining us at the Innovator Circle. I was wondering if you could share your experiences on the utilization of SAA with cases of peritonitis. From what I understand, you guys see quite a bit of it out in California.
Yeah, we do, and it's been very beneficial to use SAA in managing those cases.
Diagnosis and management, yeah.
Yeah,
certainly.
response to treatment
And
as well
response
as
to treatment.
diagnosis.
Yeah.
Yeah.
Do you have any specific examples?
Sure. We had an older horse that came in for lethargy, inappetence, started developing some ventral edema, and after our workup, diagnosed him with an idiopathic peritonitis. And we were really fortunate with him because we were able to follow and trend not only his blood SAA, but his IP fluid SAA, and also the cell count and percent granulocytes. We took a lot of samples on him throughout the course of the disease.
And what sort of increases did you see in the serum as opposed to in the peritoneal fluid?
Sure. So for this particular horse, his CBC wasn't quite as beneficial for us because his white cell count would stay sort of static. But when he first came in, both the blood and the IP SAA were quite significantly elevated. And then once we implemented treatment, we could really see a strong correlation between his improvement clinically and a progressive decline in both the blood and the IP SAA, as well as the total nucleated cell count. This particular horse, we made an antimicrobial switch when we were getting ready to gear him out of the hospital from an injectable to an oral. And when we rechecked his parameters, we found that he was not responding well to that antimicrobial switch in both the SAA and the IP SAA, blood and IP.
So did you notice a spike in the SAA first, or did you notice a deterioration clinically, or they both happen simultaneously?
More so a change in his SAA than a clinical change.
Okay.
So he didn't change all that much, but the blood IP SAA climbed and IP SAA climbed, and so did the belly fluid, total nucleated cell count, and percent granulocytes. They doubled again.
Yeah.
So
I guess in summary, in these cases, it's very useful in the diagnosis, monitoring, response to treatment, but also in that transition phase when you're trying to get the horse onto an oral antibiotic that you can potentially send him home on. It's potentially a useful monitor to see and ensure that that's a smooth transition as well.
Yes, definitely. And we found that they all paralleled very well. So the blood SAA paralleled the IP SAA, paralleled the total nucleated cell count, and how the actual fluid itself was looking.
Great. That's a great example. Thanks very much for sharing that case with us.
You bet.